Good morning, John. How are you doing?
Good morning, John. How are you, sir?
Doing well, doing well. So I always say this every time we get together, but it's so hard to believe. It's already March. Can you believe it? It's already March. I mean, winter sort of flew by. It wasn't too bad here in Dallas. I know y'all got hit with a couple snowstorms, but we are ready for spring. Are y'all?
Yeah, we're definitely ready for spring. And I'll tell you, I was actually at the doctor's yesterday, and I had to use my mobile device to fill out forms. And then there was a computer in the actual checkup room, and everything was filled through there. So there's so much technology in the doctor's offices. I couldn't even believe it. And by the way, everything's okay. I'm going to be great.
That's good. So we'll be stuck with you for at least a couple more years, right?
Yeah. So it probably ties into today's conversation, I would think, right?
It absolutely does. We're going to talk about healthcare and health services. So without further ado, let's actually bring on our guest. We have got Uday Madasu, who is the CIO of the Jewish Board of Family and Children's Services, based up in New York. Welcome to the show, Uday. How are you doing today?
Thank you, John and John. Good morning, everyone. Happy to be here.
We are excited to have you here today. So you have to tell us a little bit about yourself and a little bit about Jewish Board and exactly what you guys do. It's extremely fascinating.
Sure. Yep. I'd love to. So let me talk a little bit about the agency first, and then I'll tell you a little bit about who I am and what I do. So the Jewish Board of Family and Children's Services is New York City's largest health and human services agency. So we are a healthcare service provider, but the focus of our work is slightly different. So we provide mental health, behavioral health, substance use disorder services, and we are a community-based provider. So we serve roughly 40,000+ clients who live in communities in and around the 5 boroughs of New York City. And we serve them from over 65 locations spread across the 5 boroughs. So we are a very New York City-based provider. Our agency has roughly 3,000 employees that work out of all of these locations. And my role at our agency as the Chief Information Officer primarily is to support information technology support. So I have a team of people that help the 3,000 staff leverage technology. But over the last few years, my role has evolved. So I am now also helping our agency with other corporate service functions like corporate compliance, quality improvement. And recently, I started getting involved with helping our agency in a couple of human resources, people management related areas like benefits, onboarding. So the key there is my role is evolving to help our agency with process management, data management, information management, beyond just the typical or traditional role of a CIO to provide IT support, right?
So wait a minute, Uday. Wait a minute. So I thought we had a CIO on the call today, but you're telling me that you've got HR functions, compliance, governance, and quality. So tell me.
IT.
Somebody got a raw deal at the Jewish Board. So seriously though, tell us about how you think the CIO role has changed, because as I'm thinking about it, all those areas you talked about are filled with data. So is that the connection point?
Yep. Process and technology. That's the glue that brings the people together so that people are productive, people are efficient, people are effective. And we are a people business, right? We are in the business of people helping people, and we are using tools to enable them to do so. So traditionally, the CIO's focus was very making sure that the lights are on, making sure that the plumbing is good, right? And that has evolved a lot of us as we get closer and closer to understanding our business, have figured out not only how to leverage technology to enable the business, but now we are actually taking on business functions ourselves. So I don't think it's new and unique to what I'm doing at Jewish Board. I think this is happening across healthcare. It's happening across other verticals. And I think you'll hear and see more and more CIOs or people who are providing digital technology support extending themselves into supporting businesses in other areas because
the thing I think about this, Uday, is if you think about a CIO from 10 years ago, it was a cost function. Keep the lights on, the guy with the wires, make sure, computers are working, and maybe even have the office in the basement. But now it's actually it could be not for you necessarily, but revenue generation, patient experience, right? Employee experience. There's a lot more. And so you think, again, this trend, you think as CIOs, you'll see this stretching their roles across the industry, you think?
Yeah, at least in healthcare, I think we are still going to provide what I'll call corporate service support because it's not going to be easy for us to get directly involved with providing patient care or client care, but absolute focus on improving staff and user experience internally. But at the same time, given where we are going with leveraging telehealth, virtual health, extending that same investment in people and process to helping our clients with their user experience, the way they use the same technology that we are using. For example, people are using Microsoft Teams not only to do internal communication collaboration, but Microsoft Teams has become a platform to provide telehealth services.
Oh, wow. No, that's awesome. That's awesome. So it's really cool that we're talking about this because we've had a couple of guests, not very many, but a couple of guests on our show that actually have multiple roles. And some of them have been like CIO and COO. Yours is a very, very unique one. But what I think is really interesting, and John mentioned it as well, is this trend. Number one, for CIOs, they have moved front and center. And number two, you now have a seat at the table. I mean, truly, CIOs have a seat at the table because every business needs enabling technology support, and that's your function. And I think one of the things we'd be remiss in talking about is I'm sure that you have a robust team internally to do this, but you obviously must have some external partners that you count on and rely on, right, from a collaboration and implementation perspective.
Yeah, definitely. I mean, our agency and I depend on successful partnerships to help leverage technology. So we have a couple of different partners that help us with this digital transformation, business process reengineering and transformation. Obviously we use lots of tools. So our electronic health record system partner is a major player, right? Without their help, we wouldn't be able to provide the services that we provide, pay our people, and get paid ourselves because we are largely a Medicaid and Medicare reimbursed service provider. So we have to be able to provide services and bill the insurance companies to get paid. So EHR vendors are partners in a major way. Then we have major technology partners. As a nonprofit agency, I leverage a lot of help and tools from Microsoft. Right in the middle of the COVID pandemic, we actually got Microsoft to donate almost 3,200 licenses to our agency so that we can start using Office 365, start using Microsoft Teams. So Microsoft is a huge partner for an agency like mine. And then we have people partners, right? We work with a company called Gavs Technologies. They're our digital transformation partner. But one of the things we've done is, as my role has evolved in the agency to do more than just IT function, I'm also asking my partners to think differently about what they bring to the table. So now I'm using Gavs, for example, that was providing traditional IT support. They're now providing client-facing support, right? So when a client calls our agency, it's somebody from my IT managed services company that answers the phone and says, "Welcome to the Jewish Board. How can I help you? I have a son that's acting out at home. I need help." Great. We have early childhood programs. We have mental health clinics. Where do you live? I live in Brooklyn. Great. We have a clinic in the borough of Brooklyn that's easily accessible. So that's the kind of support that my partners are now extending to help our clients, help our businesses beyond just what they were doing from just a IT support, right? I'm extending my the Gavs partners to actually help with HR onboarding function, HR benefits management function, a little bit of quality improvement function, right? Anywhere where I can leverage data management, process management, especially all of us are working remotely. So, the earth is truly flat. I could go as far as I want to go as long as I can find the right people with the right skill sets to do this kind of work.
My goodness.
Yeah,
And just to, go ahead, John.
No,
Sorry.
we've got actually Scott Taylor listening in today. He's called the Data Whisperer. And I think one of the things he would ask if he was on the show, Uday, is, when you think about all this data, this disparate data sets, how do you help normalize all that data? Is it, does GAVS work with you on that, or how do you normalize all that information?
Sure. Yeah. So we use lots of different ways to not just get data into all of our clinical financial operational systems, but a big part of the work we do is figuring out how to get the data out, how to make the data available to folks that need to use it for decision making. So like everybody else, we use technology to create data lakes, data warehouses. We use business intelligence software to make the data available. One of the great things that we've successfully done at our agency is when we go live with different types of software, there's no running reports in the software. We've created a central data reporting model using software where no matter who you are, what you do, what piece of software you use, if you want to know what's going on, one-stop shop.
Wow.
One-stop shop to access any kind of a dashboard or a report that gives you the ability to know, is your work really making a difference? Are you really able to help our clients? Are our processes streamlined, efficient? Are our staff productive? How are we doing with engagement with our staff, right? We recently started using a formal set of tools to engage our employees, gauge their experience, help with performance management. How do we make sure that our managers in our agency are becoming available, articulating the vision down to the staff? Do our staff think our managers are doing a good job, right? It's all about collecting or gauging the pulse of our clients and staff so that we can constantly try to become a better agency, both for our staff, but also for our clients.
Love it. And to share with our listeners the complexity of what you do. You're not just a health services provider. You also, through a combination of ownership and leasing, have over 60 some odd properties in the 5 borough areas that you're managing the residents that live there and everything as well, right? Talk about that for a couple seconds.
Sometimes if you sit in some of our meetings, you'll actually think we are a real estate company managing properties in New York City. So we own over 36 properties spread across the 5 boroughs of New York City, and we rent or lease another 36 properties across the 5 boroughs of New York City. So we have a lot of focus, and we are constantly, especially in the last 2 years, we are constantly reevaluating a real estate portfolio, right? That's the real estate side of our company, because we are constantly trying to figure out, is it worth owning a building in Midtown Manhattan, or do we sell it, take the money and reinvest it in developing housing? We have a huge need for housing in New York City. So one of the things we've done recently is partner with a housing development company to build a new 100-unit housing building so that we can provide housing services, right? We use this model called housing first model because we think having a stable home is a big step in helping with folks deal with all kinds of other issues. So agencies like ours are focusing on social determinants of health in a big way: housing, employment, access to food, right? These things make a huge difference in many, many people's life. And it's not just the focus on primary care or physical care or medical care, mental health, behavioral health, substance use disorder, social determinants of health. That's going to be, I think, a major focus area for us as we go forward.
I don't know if it's been in the news, but we're just coming out of a global pandemic. What kind of impact did that have on your business when you think about, work from home, patient, and how did technology help you make that transition? And was it a quick transition? Did it happen? How quick did that happen?
Yeah, definitely. So pre-COVID pandemic, we were an agency that was not really using a lot of telehealth services. We were really using telehealth to deal with some staffing and logistics issues. We were trying to connect, let's say, bilingual clinical providers that are in the Brooklyn borough with clients who need help in the Bronx borough that just couldn't travel to the other borough, so to speak, right? So less than 5% of our services in our clinics, Article 31 outpatient mental health clinics, were leveraging telehealth. COVID happened, and we basically had to scale that model to virtually 100% of our clinics were delivering services virtually. We had to do it that fast.
Wow.
The good news for us is because we had always had staff working remotely because we provide a lot of services in the community. So staff working remotely was not new to us. We had the foundation set up for people to be able to work remotely, work in the field, not necessarily from home, but staff are working remotely from people's homes, so to speak. So when we had to scale that model, we had the underlying foundation infrastructure in place, and all it was scaling it. But that's easier said than done, because we suddenly had to equip hundreds of staff to work from home, give them the right equipment, make sure they have the right bandwidth, make sure they're trained in using these new tools, because this was new for them. Simultaneously, we also now had to increase, like I used to think about providing IT support for 3,000 employees. Suddenly, when we started doing telehealth, that 3,000 employees became 10,000 users, because I had 3,000 employees to provide remote support, but now I had suddenly a couple of thousand clients who needed to use the same tools to get services remotely. How do I connect to your patient portal? How do I use your mobile app for telehealth? How do I make sure that I'm getting my appointments, right? We have to provide technology support. So we had to sort of change the way we do things and think a little bit differently about who we are supporting. It's no longer just IT being an internal function, but IT became an external facing function, so that we are leveraging the same tools that we use also for our clients. Microsoft Teams, for example, how do I get clients and families to learn how to use Zoom and Microsoft Teams for telehealth services, right? So,
yeah, and oh, go ahead. Sorry.
I was just going to say, so, and that trend, I think, was predominantly accelerated by COVID. I don't know that we would have thought that way and done all of that work if not for COVID. So I think COVID accelerated digital transformation in some of our kind of agencies where we were being a little slow to get up to speed on some of these things.
And from a technology adoption perspective, so if COVID accelerated it, and literally it was like a knife edge cut over, where one day you had to be literally, enabled with all these tools, how challenging was it to actually get people to feel comfortable using that, both internally from a staff perspective, as well as the several thousand users, like you said, that had to be instantly trained on how to use those tools as well?
Yeah. Was not easy. As you know, different people have different levels of learning. So we had to be very creative. We had to do lots of training, lots of hand holding, have very good support processes. One of the things we do is before a telehealth session starts, 15 minutes before that, actually somebody from our client contact center reaches our client and says, hey, you have a session starting at 10:30. Are you able to access the patient portal? Are you able to connect your device? Do you have internet access, right? So making sure that we do that prep work, both for the staff and for the client, so that the session is successful. That requires setting up different processes, setting up different people with different skills to be able to do that work, so that the goal is to make sure that the 10:30 session is kept between the staff and the client, and not letting technology become an obstacle. So whatever we can do to enable that session, that's what we are doing, right? So a lot of training, lot of support, thinking about leveraging tools in a different way. So we've been doing that for the last 2 years, and I think we'll be doing it for a while, because not everybody is comfortable. One of the things that happened very recently is so in my compliance function, we have a hotline where people can call and tell us when they're unhappy with us. So we recently had somebody who complained that they don't like us providing services to them only virtually, right? Many people want the ability to come back in person, meet the therapist that's providing services, be able to see their face. So I think we are going to have to struggle with this dynamic a little more to figure out how to make this work for everybody, not only for us as a provider, but also for our clients, their families, and our communities, because not everybody is equally comfortable with technology. Not to mention, a lot of the work that we are doing is also closing that digital divide, right? For example, a big initiative right now is making sure that we provide Wi-Fi access in all of our residential properties that have families, kids, Because previously they didn't have Wi-Fi in these buildings. Wi-Fi is great, but Wi-Fi is not cheap. Somebody's got to pay to implement Wi-Fi. So now we have, thankfully, city, state, federal funding to be able to build the infrastructure so that people have the ability to leverage technology to gain services. Now, the good news is once we provide Wi-Fi, our clients are not only going to be able to leverage services that we provide, but then our clients can send their kids to school virtually. Our clients can talk to their primary care physician virtually. So the infrastructure investment is going to be extended beyond just our ability to provide services. We are truly helping our clients and their families get other services, look for jobs, be employed, and work remotely, right? I mean, we run a handful of domestic violence shelters across the city where we have kids that needed to go to school. And, without Wi-Fi, some of these kids were using mobile hotspots and tablets with very, very poor or bad connectivity. Cellular access is great, but it's not equal across 5 boroughs of New York City. We have tons of dead spots all across New York City, right? So these are some of the challenges that we have to think about as we think about providing services virtually. I think it's here to stay, but we still have a lot of work to do to make sure that it's equitable and everybody can use it in the same way.
So it was 5% before, it went to 100%. It might go back to 30%. The point being is it'll be a mix.
Yeah, we actually don't think it'll go back as low as 30%. We think it'll probably end up being a 50-50. I think there are lots of people who love the convenience of getting services virtually, right? Mental health in our country still has a lot of stigma associated with it. So there are lots of people who like the idea that they can get services that they really need and want without having to travel. Sometimes it's not easy to travel even in Manhattan that can boast of a great subway system or a public transportation system. So I don't think it's going to go back to 30%. It'll certainly be at a 50-50. And there are some folks in the community that just like the ability to receive services in person, and we are not going to say no to them. So we are also not saying we'll only provide services virtually. We have to find that right balance that works for our staff and our clients.
Yeah. And I think you mentioned the stigma, and I was pretty excited this week, and I think many in the country were, that the president talked about, focus and new funding for mental health in the United States. How is that going to impact you and your organization as you think about moving forward? Is that going to help fund some of the initiatives around technology to assist patients?
Definitely. So the funding is going to help in a couple of different ways. One, it's going to help us build the infrastructure to provide services. Two, the funding is going to help us recruit and retain talent, be able to compete in the market with the appropriate wages to be able to recruit, retain talent. The money is going to help with providing new services to our clients that we are currently not able to provide. The money is going to help with professional development of our staff, right? A lot of this work requires a lot of training, not just one time, but ongoing training. Training costs money. So that's where the money is going to go. It's equipping staff, developing the infrastructure, provision of services, being able to recruit. Healthcare currently has a major crisis with recruitment and retention. And to be able to have good people working for us, we need to pay them properly. And we need help, we need support to be able to do that.
That's great.
So, we always say that none of us have a crystal ball, but we love to think 2, 3, 4 steps ahead. And in this business, I know that you all are sort of in multiple businesses, but from a primary focus perspective on providing services and health-related services to your clients in the New York area, what would you sort of say are you thinking about? What's coming down the road, from a technology perspective, and what do you think will 2, 3, 4 years down the road look like, and how may that impact your role and your team's role and your partners' roles as well?
Yeah, absolutely. So for me, there are 3 major focus areas. So one of the major focus areas for me at our agency is going to be leveraging automation. Automation not only in terms of being able to deliver services to clients, but automation in the back office, corporate service automation, right?
Yeah.
We've all heard healthcare is expensive. Healthcare administration costs are just out of control. So one of the ways to bring them under control, I think, is to use technology, to use automation, where we can do more with less. So that's going to be a huge focus area for us. We've already done lots of interesting things to bring automation into IT service management, but now the trick is going to be bringing in automation into corporate services, HR, finance, payroll, purchasing, wherever we can to leverage technology so that we can use the machine to do a lot of the work and then have people do different things to continue to help clients. Another area I think is going to be a continued focus on analytics, right? We all do a really good job of getting data into the systems, and the trick is getting data out, making data available to people that so that they can use the data for meaningful, actionable insights. The third area, almost because we don't have a choice, is going to be sort of a continued focus on cybersecurity. We are required by law to pay attention to privacy security. The world around us is changing very, very fast and in a very different way in terms of privacy security. So that's always going to sort of be, something that we are constantly thinking about. And as we work with our partners, they're going to help us in all of these different areas, because this is not the kind of work that we can do as providers. We are a healthcare provider. We are not a technology company. So we are dependent on providers like our friends at Gavs Technologies to help us think about how do we bring automation into play? How do we do advanced analytics, predictive analytics, prescriptive analytics? A lot of the analytics currently is descriptive, but we want to take that to the next level, do some predictive analytics, do prescriptive analytics if we could. So we are going to depend on these partners to really help us figure out how to use new tools and how to extend the tools that we already have invested in.
So are you all getting, this story is fascinating, and it sounds like you are absolutely on top of what's happening over there. The organization is doing great things for an enormous amount of people.
Yeah.
There must be other people in other major metropolitan areas around the country, even around the world, asking you guys to help them set up something similar there. How it must be, right?
Yeah. So we do a lot of collaborative work. For example, not only in some of the areas that I'm partnering in, we do lots of work with peer agencies where we are sharing ideas, sharing services, partnering with providers to provide services so that we have continuity of care. We, for example, are a owner, founder, and a participating provider in an IPA in New York City. It was a way for us to have economies of scale so that we can go negotiate a better rate with managed care companies, right? Because as a provider, we could be a service provider for 40,000 clients, but when you bring in an IPA with 50 providers, we are covering over 1 million lives. Managed care companies want to have a broader impact when they are negotiating rates. So there are ways where we collaborate with other similar providers so that we have a reach of either service delivery or just geographical care. So we have lots of partnerships that we are currently engaged in.
Wow.
Well, this has been, I tell you, Uday, this has been an incredible conversation. Thank you so much for joining us today. Certainly the work you and your team at the Jewish Board for Family and Children, it's absolutely incredible. You should be super proud, and we thank you for the service. And really was educational because there's a lot of great technology happening inside of the healthcare space, and we learned a lot today. So thank you so much.
You bet. Yep.
Thank you so much. We'd love to have you back on soon. Thank you.
You bet. Yep.
Bye-bye. Take care, Uday.
Wow. We have some great guests, and I got to tell you, this is one of the most incredible guests. I mean, he's the thought leadership. He has a plan. He has a strategy. He has a plan. He's implementing it. He's got contingencies. He's talking about the right way in terms of partnering and collaborating. But did you notice it was interesting, John, how he was really focused on one primary thing, and that is taking care of the end customer or the end client, the patients, right? Or in some cases, residents that live in their 60 some odd properties, right? Just an amazing story. An amazing
story. And I tell you what I learned today and I found really interesting, and it'd be good to hear from people that are listening or get other points of view, is the role of the CIO and how much that's evolving to be part of the corporate compliance, quality, and even having functions of HR responsibility. It's really a broad reach that the role of CIO is taking. So really incredible. And looking forward to hopefully hearing more over the next year on what's happening in healthcare. Speaking of healthcare, John, we've got an incredible event coming up on April 20th, and that is going to be in Chicago, the Tech Exchange Health Sciences event. And definitely hoping to see people live there. I think it's going to be a great event.
It is. It's going to be a face-to-face event in Chicago, and we've got a great slate of external speakers, ISU speakers, and panelists. Very intriguing and super timely and relevant topics. So it is going to be the place to be, Chicago, on the 20th of April. It's going to be at the Radisson Blu, which is a really cool and hip hotel too, so that doesn't hurt.
So yeah, I'll be there. So, I mean, come on, come visit. There you go. All right, John. Listen, it's always a great seeing you.
Great seeing you too. We'll see everyone in 2 weeks. Thanks, everybody.
Bye-bye. Take care.